So what can we do? Well, these are the skills of master physicians. This is a paper written about 15 years ago. These guys surveyed about 50 people in Nashville. They're at Vanderbilt. And they found that these are the things they all do well, and they all do that are kind of unique. They do the little things. They pay attention to detail. They take time and listen. They're open to whatever's going on. They find somebody to like or to love about the person across from them. They remove barriers to care. They let the patient explain before jumping in with their own thoughts on it. They share authority for what happens next, and they are committed and trustworthy, letting people know, I will be here, and I will be here for you, or I will tell you who will be here no matter what. Now, what's interesting about this, there's nothing on that list about medical knowledge or procedural skill. Those things are important, but those things should be taken for granted. These are the things that make a healthcare provider not just competent, not just licensable, but this is what makes healthcare providers extraordinary and outstanding. So what we need to do is create trust. Assume parents love their kids. Don't ever, ever, ever use the dependent clause, if you love your child. Don't ever put if in front of that. Start with, I know you love your child. Recognize that parents have a very different knowledge base than we do. They haven't gone to medical school, they haven't gone to nursing school, they haven't gone to public health school. They don't know the things we know. And again, I'm really glad we had the previous session because so many of the things here follow from that. I mean, one of the people in that, I remember a patient saying something about, I wish they would dumb it down, and I hate that phrase. But the fact that someone would say that says something about what they consider healthcare providers to be. We shouldn't dumb it down for anybody. We should be able to translate it into standard English. When I was, my mother has gone on to her heavenly reward, but before she did, she would often call me with questions about her health, having seen her doctor, and deciding to call me the pediatrician. Has anything like that happened to you? Yeah, I'm sure. Why do people call us instead of their own doctor or their own nurse practitioner? They know us as people. They know us as someone they can trust. And sometimes with doctors, with nurse practitioners, with physician assistants, those of us who are primary care people, we may give them the feeling that I only am interested in these things. Don't ask me anything beyond that. So the thing is, my mom would call me and I would explain things in everyday language. But every once in a while, I would use a medical term and not explain it. And she'd go, now, Kenny, I know you're a doctor and I know you're smart, but I'm your mother. Explain it to me. Okay. So I think of that as the my mom test. How would I explain it to my mom? How would you explain it to someone you love who is not in this profession in a way that they can understand and a way that they could trust? So I think it's really important to realize that statements that sound factual are really emotional. People are coming from an emotional place. So we have to honor and value those emotions. We have to ask parents about the basis for their fears. Acknowledge that parental fear is real and even healthy. So the thing is, the facts, the so-called facts that this fear may be based on may be completely bogus, but the fear is real and the fear is valid. This is where we can finally get to the point where we help patients acknowledge the appropriate target for their fear, which is the disease, not the vaccine, and finally provide a fertile ground in which trust can grow. So this is where we get to the yes and improvisational theater. This is the cornerstone of it. Actually, Lana expressed the other cornerstone of improvisational theater, which is listening to understand rather than listening to respond. Now, those of us who've been in medicine a long time, or in healthcare a long time, I mean, I'm going on 45 years now. I know I look pretty good. But the thing is, I can pretty much look in Epic and look at a chief complaint and look at a chart real quick, see why a person's there. I know exactly what they need. I know exactly what the assessment is. I know exactly what the plan should be. And I could walk in there and say, what are you here for? And here, I'd be like Charlie Brown's teacher. I could go, yeah, okay, that's right. Here's what's going on, here's your prescription, and walk out. But what happens is when they're going, wow, they may tell me stuff that I had no clue that they were going to bring up. And I go, oh, that's interesting. So listening to understand is actually listening, actively listening to what someone says, and then responding to that, and maybe letting go of the preconceptions on it. So that and yes and are the hallmarks of improvisational theater. And who are these people? Whose line is it anyway? Okay, who's seen an episode of Whose Line Is It Anyway? Well, go out, if you haven't, go out and watch one. There are about like 900 episodes of it. But basically, this is what motivational interviewing is. It is saying yes and to the person across from you. In improvisational theater, people are given a situation. Someone starts the improv, and then the other person or the other persons say, I see what you're doing, and here's what I add to it. And the first person goes, and I see what you're doing, and I add to that. And you go back and forth. And the thing is, patients and parents, I found almost all the time, they don't know they're doing it, but they want that kind of response. And they will give that kind of response if we allow that to happen. So it is the most important rule in improv. I really think that this is the basis for Carl Rogers' unconditional positive regard, which he talks about in his work in the 1950s, finding somebody to like or to love about the person across from you. Again, listening to understand versus listening to reply, and knowing the difference between on stage and backstage. So what are our roles in our scripts? We've talked about a lot today, but education is about repetition, so I'll say it again. People respect us. We can use that. Being aware of our tone of voice, our body language, being on the same physical level as people as much as possible, sitting down when you're in the room with them rather than towering over them. All this stuff is really important. Avoid contractions, avoid contradiction and the conjunction but. That's wrong, but what you need to know is, or I care about your kid if you loved your kid. We don't want to do that stuff. That is called the no but response. No, you're wrong, but this is what you should know. Within our professions, that makes sense to transmit factual information, but in the patient care setting, it does not. So we want to agree and use the conjunction and. I hear the fear in your voice. I see you love your child. May I offer some other information for you? I want the same thing that you do. So everyone in the office has to be on the same page. Again, we talked about that in the previous session.